Hello and welcome back. In this lecture, what I want to cover are your required muscles. Now, in the past, I've told myself I'm never going to ever lecture on required muscles because students usually fade out pretty quickly when you go over muscles. So what I plan to do is use this time to show you your required muscles and to, maybe give some brief explanation as to what they do, and then also pronounce them for you so you can learn how to pronounce the names. That's oftentimes difficult in these muscles because they're all in Latin and most people don't speak Latin anymore. So I'll give you a few tips on how to say them, and in lab we'll go through these muscles and talk about them and learn them more extensively. And I just wanted to highlight to you that your muscle test will come from it'll come from models. So it will not come from you looking at pictures. So it is important that you realize that the models, you're going to have to look at those models and really learn the models when you're in lab class. So I have reduced down the number of muscles you are required to know. The human body does have over 600 muscles, so I've only required you to learn, very few of them compared to that. And most of the muscles I picked are superficial muscles that you can physically find on your own body. They're superficial, so you can see them. You can see them in weightlifting pictures. And here we go with learning the muscles. Now, it's a daunting task. If you look in your chapter of your book, you're going to find pictures that look something like this. And it's kind of overwhelming when you see a picture like this. So what I've done in this lecture is I've taken and isolated the muscles so we can learn them muscle by muscle. I find it to be more useful than looking at thousands of names on a picture like this. So you got to take it step by step. It is hard to learn these muscles, but I think if you take and break it down muscle by muscle, that I think it's easier to just isolate them and learn them in that kind of fashion. All right, so our first muscle is the occipitofrontalis, and you can see the frontal body of the occipitofrontalis in this particular diagram. If you go to the back side of the head, the occipital belly will be on the back surface. But this is going to allow you to raise your eyebrows and do things of that nature. So that's the occipitofrontalis. So the levator labii superioris basically tells us what it does. It's going to elevate the lip and it's superior, so it's on the top. Okay, so there will be one that's on the bottom and it'll have a different name. So if you want to pull the corner of your lip, this region right here, you use the levator labii superioris. So most of these muscles are going to name like what they do, where they're located, and what they're attached to. At least the people that named them in a good way. The zygomaticus, so you know that it's going to attach to the zygomatic bone. Major means that it is the highest one. So zygomaticus, actually it's the biggest one. The zygomaticus major is going to pull on the corner of the lip. The depressor anguli oris, so it depresses or pulls down the angle of the mouth, is how that basically is why it's named that way. Depressor anguli oris. So here we have the orbicularis oculi. So you know it's going to be, oculi means eye. Orbicularis is going to be a circular muscle that goes around the eye and allows you to close your eyes shut. So if you close your eyes tightly, that's using your orbicularis oculi. The masseter is a very powerful muscle that's attached to it's attached up here to your zygomatic bone and your mandible, and it's going to elevate the mandible. So it's going to pull the mandible in this way. So when you tightly clench your teeth, the masseter is helping you to do that particular activity. The orbicularis oris is a circular band of muscles around the mouth and allows you to close your mouth. So if you purse your lips real tightly, that's the orbicularis oris doing that activity. So from a side view, we have the temporalis. The temporalis is going to be attached, of course, to your temporal bone. So it's attached to the temporal bone here, and it attaches into your mandible, which is underneath this right here, and it allows you to elevate your mandible. There's the masseter again. We've already talked about that one. Attaching the frontal body and the occipital body of the occipitofrontalis is this epicranial aponeurosis. It's a sheet-like tendon that connects the two bones together. Excuse me, the two muscles together. So when I pull on this muscle, it pulls on this part down here. So that's the epicranial aponeurosis. Zygomaticus major we've already talked about. The depressor anguli oris we've already talked about, just seeing it in a different angle here. The platysma is a sheet-like muscle that goes across your neck, so it's across your whole bottom of your neck, and when it pulls, it's able to pull on your mandible. The buccinator is a muscle that connects in to your lips and will pull on your lips. It'll pull your lips laterally or to the side. That's the buccinator. So looking at the floor, kind of the floor of your mouth, there are many muscles that are attached in. So the digastric is here attached into your mandible and into your hyoid bone. Many of these muscles are going to be helping you in swallowing or moving your mandible in some kind of way. So this one has the ability to depress your mandible. So the omohyoid is connected into your hyoid. Okay, and it goes down. I'll show you a better picture of where it attaches in just a second. Again, it's going to be pulling on your clavicle. Many of these lower muscles here are going to be helping in swallowing, moving the larynx, depressing or elevating the larynx. The sternocleidomastoid tells you exactly what it attaches to. It attaches to the sternum, it attaches to the clavicle, and the mastoid process of the temporal bone. So you can see the little mastoid process right there of the temporal bone. And this one's going to allow you to turn your neck to the side. So if I contract one of my sternocleidomastoids, I can pull it to the side. If I contract the other one, it goes to the other side. Maybe you've torn this before or made it, slept on it funny and it made it sore, and you couldn't turn your neck very easily the next day. The myohyaloid is this muscle here, making up kind of the bottom of the floor of your mouth. Myohyaloid. Excuse me, mylohyoid. The sternohyoid is attaching to the sternum and the hyoid, and again, it's going to aid in movement of the larynx. There's that omohyoid. It's kind of a weird one. It goes from the hyoid all the way down and attaches into the scapula. So kind of a strange muscle there, moving across that far. And the sternohyoid, you can see it's attached to the hyoid and it's attached to the sternum. So it's attached to the manubrium of the sternum. The trapezius is going to allow you to shrug your shoulders. It attaches all the way up into that occipital protuberance in the occipital bone, comes down, attaches into the scapula, attaches into the vertebrae. Okay, so it's a pretty massive muscle allowing you to shrug your shoulder. Moving into some back neck muscles, we have the splenius capitis. And this is going to allow you to move your neck in certain areas or certain ways. Then we have the levator scapulae. It's going to elevate the scapula. So the levator scapulae. We have then another neck muscle allowing you to move your neck, semispinalis capitis. Semispinalis capitis. Allowing us to pull the scapula in this direction will be the rhomboid major. So it allows you to pull your scapulae towards the midline of your back. Rhomboid major. So here we see the rhomboid major again. I'm not requiring you to know all the muscles like the rhomboid minor, but just trying to reduce down the number of muscles you had to know. So rhomboid major. The deltoid is going to allow you to do all kinds of things with your arm, adduct and abduct your arm or pull your arm out or in. So the deltoid. The latissimus dorsi will also allow you to do things with your arms. It allows you to pull your arms backwards. Latissimus dorsi. So we have the supraspinatus. The supraspinatus So this is going to allow you to do some strange things with your scapula. We then have the teres major, which allows you to pull your arm in toward the midline of your body. That's the teres major. So periodically you might want to stop the video and just practice what you've learned so far. So, do you know what this muscle is? The deltoid. Do you know what this muscle is? The latissimus dorsi. How about this one? The rhomboid major. How about this muscle? Supraspinatus. All right, so moving to the front of the body, the anterior of the body, in the thoracic and abdominal region, we have the pectoralis major. You can see it grabs a hold of the humerus and it's attached to the sternum, so it's going to be able to pull your arm in, do different things with your arm. The linea alba is this sheet, it's this line right here, but it connects with the tendon to all of these muscles we're getting ready to talk about, your obliques. So it just is a connecting in to both sides. Okay, the sheet's been taken away over here so you can see deeper into the muscle. The thing about muscles is there are a lot of muscles that are deep and some are superficial. I've tried to focus mainly on superficial muscles in this lecture and for what you're required to know. So this is the external oblique, and you can see the fibers are running in this kind of direction, and they attach in and allow you to twist, twist your thorax and abdomen. Serratus anterior, you can see these are little muscles that are attached into your ribs. Serratus anterior. So this is the rectus abdominis. This allows you to flex or pull your, do a sit-up. So that's called rectus abdominis. Transverse abdominis is if you go really super deep underneath the internal obliques and the external obliques, you can get to the transverse abdominis, and it's these muscles right here. And they're going to allow you to do the various kinds of motions with your abdomen. We have on top of that the internal oblique where the fibers run in this kind of direction. So that's your internal oblique. Again, the external oblique, rectus abdominis, transverse abdominis, and internal oblique all allow you to do all kinds of flexing and twisting motions with your abdomen. So again, periodically practice what you know. The only way you learn stuff is by quizzing yourself on what you know and what you don't know. So I have put a series of blank PowerPoint slides that you can practice with. So I have some of them with lines and some of them without lines. So hopefully you'll print those out and practice those. But always remember that what you really have to know is what's on those models, because that's what your test is going to come from. This is just showing the linea alba, and the external oblique has been removed so you can see the internal oblique. You can see it's a nice large muscle. And then you can see the transverse abdominis over here. So it just gives you a little bit better view of the transverse abdominis. So there's your trapezius with some of the muscles removed, so you can see how that's organized. You do have a pectoralis minor, which is going to grab a hold of your scapula and be able to pull your scapula anteriorly. And you can see it's attached to the scapula and it's attached to the ribs. So when it pulls, it can rotate that scapula forward or anterior. And it's attached to the coracoid process, if you notice that. And there's the levator scapulae, which elevates your scapula. So this is a view from around the anus region. So that would be the anus right there. And external anal sphincter is a series of muscles around the anus. So it allows you to close tight the anus. So moving up to the arms, we have the biceps brachii. You can see the biceps has two bellies to it, and one of the bellies comes up here, goes through the intertubicular groove, and will attach into the scapula. The other belly will come up through here and attach to the coracoid process, and then they come down and they will attach to the deltoid tuberosity and then down into the ulna. Okay, so it's nice to know that bones and muscles, they work together, and if you learn your bone parts, then it helps you to learn how your muscles are connected in. So that's the biceps brachii. And brachii refers to arm, and biceps means two heads. So the brachialis is located underneath of the biceps brachii, and that's called the brachialis. And then on the back side or posterior side, we have the triceps, and there's actually 3 parts to it. 1, 2, 3. So triceps means 3 heads. And this allows you to take and extend your arm, your forearm. You know, in lab, you want to take and flex each of these muscles and see what they do so you can understand better how they're arranged. Here's your brachialis. We've taken the biceps brachii and sliced it so it's a little bit deeper. So that's your brachialis. And your biceps brachii has been cut. Moving to the forearm, and we're looking at the in anatomical position. We're looking at the front of the forearm. So this is called the brachioradialis. So it does connect to the arm and to the radius. Flexor carpi radialis. So it flexes the arm. So it allows you to flex your hand, which means it allows you to pull your hand. If you were to pull your hand forward, that's flexing. If you pull your hand backward, it's extending. This one flexes the hand. So it's a flexor. It is near your wrist and connects into your wrist, or goes by your wrist and connects into the radius. So flexor carpi radialis. Palmaris longus is another flexor. Flexor carpi ulnaris. This one's going to be going by your wrist and connecting to your ulna, and it flexes. Flexor carpi ulnaris. The supinator allows you to turn your hand. If you were to imagine forming a bowl with your hand, the supinator allows you to turn your hand to form a little bowl where you can collect soup in your little bowl of your hand. So that's the supinator. So you want to definitely find that on the model and practice that, flexing your hand in that kind of way in lab time. Okay, so we're looking at now the posterior part of the forearm, and this is the extensor digitorum. So this extends your digits. Okay, so if I take and extend my fingers backwards, that's extensor digitorum. Extensor carpi radialis longus. Well, it's long, it extends, it goes through your wrist, and it attaches to the radius. So extensor carpi radialis longus. Okay, now there's many more arm muscles to learn. I've just picked a few of them that I thought would be useful for you. So there are many muscles in your buttocks region that help you to do things with your legs, you know, either abduct or adduct your legs. So again, in lab, you want to touch these muscles and then do the activity so you can see how they work. The gluteus medius, gluteus maximus, and tensor fasciae lati. These are muscles that are going to be grabbing a hold of your femur and doing various activities with your femur. Okay, so make sure you practice those in lab, touching them, seeing how they attach in, and then you know, literally contracting them and see what they do. Okay, so this is the anterior leg. We have the rectus femoris. So this muscle right here, the rectus femoris. And you can see it connects into up here to your pelvic bone, and then you know, right here to your knee, eventually to the tibia. Vastus lateralis. So this is to the lateral, or to the side. We have the gracilis. Okay, gracilis. It's kind of like your, I guess some people call it your groin muscle. Again, you want to practice what these things do in lab. Abductor longus. Look how they connect in. Your leg models will be much better than, looking at the leg models is much better than looking at a flat two-dimensional picture. Adductor magnus is deep inside there. Adductor magnus. Sartorius extends all the way from your pelvic bones. It goes all the way down, curls around, attaches into the tibial tuberosity. That's the longest muscle of the body, the sartorius. And again, practice learning it and then what it does. Vastus medialis is one of the muscles of the quadriceps to the medial. Again, practice, practice, practice. So here we have the back side of the leg. These are sometimes confusing, so it's definitely one you want to give a model and practice. So on the lateral side, one of your hamstrings on the lateral side is called the biceps femoris. Biceps femoris. We then have kind of in the middle or to the medial, we have the semitendinosus. A little more lateral and a little bit deeper is the semimembranosus. And collectively, all of these biceps femoris, semitendinosus, semimembranosus, all of these will allow you to pull your leg, basically flex your leg backwards. And then abductor magnus, we didn't see it very easily on the last one because it was pretty deep, so I just put a new picture of abductor magnus so you can see I'll see it a little bit better with the muscles cut away. Practice, practice, practice. Moving down to the bottom portion of the leg, we have the fibularis. Some books call it the peroneus longus. So you can see from a kind of a lateral view, kind of where it's located right here. It extends all the way down to the bottom of the foot. So it's on the side right here. So fibularis, or the peroneus longus. And you can see it's attached to the fibula. Extensor digitorum longus. So this extends or pulls the feet backwards, the digits, and it's long. So extensor digitorum longus. So it's going to pull those toes backwards. I guess pull them up, I guess is a better way of looking at that. Tibialis anterior, so it's attached to the tibia, and it goes right across the top of the tibia, and it's in the front. So tibialis anterior. And it again allows you to pull your toes upwards and your whole foot upwards. So if you want to stand on your toes, you usually use the gastrocnemius. So gastrocnemius. And there's a couple of heads to it there. And it looks really cool and defined. It looks like little horseshoes in people that have highly defined gastrocnemius muscles. So it allows you to stay on your toes. The gastrocnemius is attached to the calcaneus down here via the calcaneal tendon. This is also known as the Achilles tendon, the calcaneal tendon. So kind of a little bit deeper is the soleus. If I were to move the gastrocnemius, you could see it a little bit better. But the soleus is located right there. Cutting away many of the muscles there, you can see the flexor digitorum longus. And this is going to allow you to stand on your toes. So flexor digitorum longus. So you need to practice these muscles. Muscles are not easy. Muscles, to me, are even harder than the bones. So that's why you have to practice even more and make sure you put your hands on those models. Put your hands on your own body so that you can feel where these muscles are. When you come in to take the test, you bring with you a cheat sheet, which is your body. So if you feel where all your muscles are, you can, maybe remember a little bit more efficiently so you can do well on the test. So the only way to learn muscles is to practice, 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 and practice on those models. The models look very different than the pictures oftentimes because they're three-dimensional. Okay, well, I'll see you in the lab, and until next time, I hope you have a great day.